Okay, it is 12:30. I am Dr. Cassie Donahue. I'm Director of Governmental Affairs for the California Chiropractic Association. Going to give you guys as much of an update as what's going on with the Affordable Care Act as I can for right now. It changes on a pretty regular basis, so this is the information as we know it. And okay, really, hold on one second because now it's not. There we go. All right, so a little bit of background for those of you who maybe haven't gotten this information before. Back in 2012, the California legislature was charged with choosing a benchmark plan for what is called the essential health benefits. They had 10 choices of plans to pick from, but in California we have a mandated autism spectrum disorder benefit, which means that all insurance plans in California have to offer autism spectrum disorder treatment. So that meant that the benchmark plans that the legislature had to choose from had to include an autism spectrum disorder benefit. Otherwise, if it didn't, then the state would have been on the hook for paying for that benefit out of the state's general fund, which obviously we didn't have in 2012. So that knocked out a handful of the choices that they had, and in the long run, the Senate and Assembly Health Committees chose the Kaiser Small Group 30 plan, mostly because it's regulated by the Department of Managed Health Care. California is is the only state that has two different regulatory bodies for insurance plans. In California, the other one is the Department of Insurance. The reason they wanted the Department of Managed Health Care plan is because it's regulated by a different set of rules and allows a little bit more flexibility with regard to how the benefits are provided. Right. So when they picked the Kaiser 30 plan, the legislature initially believed that chiropractic was a coverage benefit within that plan, because that plan is almost always sold with a chiropractic rider. However, shortly after the plan was adopted and chosen by the health committees, the HHS came out with a rule that said riders could not be included as part of the essential health benefits, and that knocked chiropractic out of that particular benefit package. We did meet with Senator Hernandez a number of times. He's chair of the Senate Health Committee, to discuss our concerns with the fact that most employer plans in California do offer a chiropractic benefit, and the federal statute's intent was that the benchmark plan that was picked should very closely mirror what most employer plans were offering. And he didn't disagree with us. However, he was concerned. He felt that our concerns were not as grave as they could be because of a couple different reasons. First of all, the essential health benefits are intended to be the floor, the bare bones minimum of what's being offered from an insurance plan. So plans would be allowed to offer additional benefits. Also, because of non-discrimination language, and we have a very broad scope of practice in California, and so he really felt like our issues were pretty minimal in terms of the overall plan, and so they stuck with what they had picked initially, which was the Kaiser plan. That will be the plan at least until 2012. HHS and the federal regulations have said that in 2012 states are allowed to choose a different benchmark plan if they so choose, but for the next 2 years that this is the essential health benefits plan. It can't be changed. So I mentioned non-discrimination. That's Section 2706 of the Affordable Care Act, and it basically states that no provider who is acting within their scope of practice shall be discriminated against based upon their licensure. So in California, as I said, we have a very broad scope of practice. So even though there is no chiropractic benefit within the Kaiser plan, there are lots of different things that are included in the plan as benefits and services that are part of our scope of practice. HHS issued an FAQ with regard to implementation and enforcement of Section 2706 back in April, and said that this regulation, or this section, is self-implementing. It doesn't require regulation to be explained, and that all insurers should exercise a good faith attempt at implementing the provision. So it also, though, said that insurers are not required to include all types of providers on their panels, which is an issue that we may have to address in the upcoming months. Right now we're sort of in the flux in terms of what the provider panels look like. I'll talk more about that in a little bit. One of the other issues that we have with the FAQ is that In the federal statute, it's the 2706 talks about reimbursement being linked to quality and performance measures only. In the FAQ, they also say that reimbursement could be linked to market considerations, which is a concern of ours because we think that that's just code for we can, pay certain providers a lot less than others for the same service. And that is not the intent of the federal statute. We don't know what reimbursement is going to look like exactly yet. I'm not entirely sure that the insurance companies have got reimbursement all figured out, but we should be figuring it out relatively soon as providers are, billing insurance plans. So CCA has met a number of times with both the Department of Insurance and the Department of Managed Health Care regarding implementation and enforcement of Section 2706. We have a legal memo that we've been providing to the different departments talking about how we believe Section 2706 is meant to be implemented and enforced. And in our meetings with the Department of Insurance, they basically agree with what our legal opinion says, and they believe that we should be able to provide all sorts of covered services that are something beyond our CMT manipulation code. However, they also feel that as a department in California that they need to have a state statute regarding non-discrimination in order to be able to fully and proactively enforce that section of the federal statute. We don't necessarily agree with that, but we've met with them a couple of different times, and what they have said is that they will respond to provider complaints, but they won't do anything proactively to ensure that insurers are following the appropriate rules. They are, however, doing a sort of a backdoor compliance where they, in order for a plan to be issued through the Department of Insurance, the form has to be approved, and if they believe the form has language in it that is not in compliance with non-discrimination, then they are not approving that plan form, and the insurance companies so far have gone along with that process. We met with the Department of Managed Health Care a couple of years back when Senator Hernandez was running a non-discrimination bill in California that would have mimicked the federal statutes, and at that time they were vehemently opposed to that particular bill because they felt like they needed to have stronger regulations out of HHS, giving them direction on exactly how 2706 was meant to be implemented and enforced. So they were instrumental in stopping that particular bill 2 years ago. Right now, they have said that they have enforcement authority based upon a health and safety code, but they still would like to see something more specific out of HHS regarding regulations on non-discrimination, even though HHS has said that this is a self-implementing regulation or self-implementing statute, and they don't intend to actually put out any regs on it. DMHC has said that they would respond to provider complaints. We had a good meeting with them with regard to what our scope of practice is, how we believe 2706 should be implemented, and they were largely sympathetic to what we were having to say, but again, they are not being proactive with regard to non-discrimination. CCA is also going to be reaching out to a group called CCIO. It's part of the feds. It's the Center for Consumer Information and Insurance Oversight, to suggest to them how we believe non-discrimination should be implemented and enforced, and to see if we can get something in writing from them that would provide DMHC with more of the clarity that they're looking for. So that letter should be going out in the next week or so. So California is one of only 17 states that are operating their own exchange. It's called coveredca.com. It is largely functional, not always. I tried to get onto it yesterday and was unable to log in as a consumer. But most of the time it's functioning. As I'm sure that you all are aware, the federal government's rollout for the federal exchange has been bumpy, to say the least. It is apparently much more functional now than it was back in October. But the federal government never expected that they would have to run the exchange for most of the states' in the United States. They had anticipated that states would want to create and operate their own exchange. But as we all know, this whole Affordable Care Act remains fairly controversial for a lot of states, particularly more Republican states. And so most of the states that are not running their own exchange have not wanted to comply fully with the whole Affordable Care Act in all of its many different versions, and so that put the feds, on the hook for taking care of it, and it has been, like we said, very, very bumpy. One of the issues that has come up in California is that our exchange board is pretty independent and has been largely left to do what they want without much oversight by the legislature. We have talked with members of the California legislature about some of our concerns with regard to the board and their decision-making processes, and we've been assured that that the legislature will be being a little bit more proactive with regard to how the Covered California Board exercises its authority, but they wanted to give them an ample opportunity to be up and running by the October 1st opening of the exchange. And so what's happened then in California, we are the only state in which essential health benefits are the only thing that can be offered on the individual plans on the exchange. That is not true in any other state. It is not the intent of the federal statute. Federal statute, as I mentioned before, says that the essential health benefits are supposed to be the bare bones minimum and not the ceiling. It should be the floor of all benefits that it can be offered. And we argued vehemently against this at the time that the exchange was making this decision, but we're unsuccessful in that. So one of the things that came up in the courses as this whole new world and new plans are being offered was I was reaching out to the various insurance plans that are on the exchange, and part of the federal mandate is that whatever individual plans are offered on the exchange, a mirror plan has to be offered off of the exchange. So that means that all of the plans that are on the exchange have exactly identical plans being offered off of the exchange for those people who choose not to purchase through the exchange. What happened, and I don't have a good explanation except for I was told that it's largely because the insurers were concerned that if they offered additional benefit packages for plans off of the exchange, that would be an increase in premium, that consumers who are unfamiliar with purchasing insurance would be confused by the higher premiums for certain plans versus others, and that they were going to go for the lowest premium plan available to them, and that would mean that insurers who offered additional benefits with a higher premium would see a smaller part of the market share. It's an unfortunate outcome. For right now, we have been meeting with the different insurance companies and trying to work on getting this changed for the future. Also in California, only the plans that are operating on the exchange, only the insurance companies that are qualified health plans on the exchange are offering individual plans in California. So Aetna and Cigna and other insurance companies are no longer offering individual plans in California. So while these essential health benefits are the floor and ceiling on the individual side of the exchange, there's a separate part of the exchange for small employer groups called SHOP, and those plans are not being required to only offer essential health benefits. I have been trying to get into those plans off of the Covered California website to see what exactly they are offering as benefit packages, and it's not pulling up for me right now. So I'm not entirely sure if the small employer plans are offering additional benefits, including a chiropractic benefit, or not. I do know that all grandfathered individual plans, those are plans that have been in place without being substantially changed since March of 2010. Those plans that currently offer a chiropractic benefit continue to do so. Also, employer plans that currently offer a chiropractic benefit can continue to do so. The federal mandate for employers to offer insurance has been delayed for a year, so that leaves most of the current employer plans sort of the same. It's not really obvious yet that purchasing plans as a small employer group off of the exchange is going to be a substantial cost savings or not. So we haven't heard that a lot of employers are changing their plans to the plans on shop yet. One of the things that was sort of a surprise to a lot of people was that, as I'm sure you all heard, the president, as he was talking about implementation of the Affordable Care Act, kept repeating that if you like your current plan, you can keep your current plan. Peter Lee, who's the executive officer for Covered California, did a series of town halls across the state leading up to the October launch of the exchange, and said the exact same thing repeatedly in each one of these town halls. 86% of Californians had insurance prior to October 1st, and the expectation was that all of those people would just keep going right along and continue to have their insurance policy, and everybody would be happy. As we now know, in order to become compliant with the 10 essential health benefits, which many of the plans did not actually cover, insurers dropped all their individual plans and moved entirely to what's being offered on the exchange. That was something that was partially mitigated by the president's decision to allow insurers to offer non-compliant plans through 2014 up until 2015. But in California, the Covered California board opted not to allow plans to do that. Dave Jones, who's our insurance commissioner, argued vehemently during the board meeting that his department was very capable of making sure that plans that were in place before October 1st would be able to continue to be in place if the board would just, if Covered California would just allow them to do that. And there was some sympathy with the board members with allowing that to happen, with everybody being so distressed by having, losing their insurance benefits that they had had for so long. But Peter Lee, again, is their executive officer and argued strongly in favor of staying the course and not moving backward, as he put it. He felt that this was just kicking the can down the road until 2015, and that people were just going to have to suck it up and purchase different insurance plans. Because of the fact that only qualified health plans are offering individual plans off of the exchange as well as on the exchange in California, that basically meant that unless the Covered California board allowed them to change their plans, that their contract with Covered California requires that they follow the rules that Covered California sets. Again, this is one of the issues that we are trying to address with members of the legislature because we don't believe that Covered California should have the authority to make as many decisions as they're making without better oversight. So I've talked a lot about the federally mandated benefits, essential health benefits. Part of how that comes together is there's 10 federally mandated benefits that are listed here for you. Chiropractic services, including CMT, but also separate from the CMT, would fall under ambulatory patient services. That would be like your evaluation and management codes. It would fall under the rehabilitative and habilitative services. That would be, and devices, that would be any physiotherapy, any rehab, any DME. All of these things that are part of our chiropractic scope of practice are also part of the mandated benefits, and we should be allowed to provide those for the insurance companies that we are on the panels for. So in California, Covered California has qualified health plans that are operating on the exchange. There's 11 of them. The national plans, or the statewide plans, I guess is probably the better way to put it, is Anthem Blue Cross, Blue Shield, HealthNet, and Kaiser. And then there are a series of smaller regional plans that are only going to be operating, obviously, in the region in which they cover. California was divided up into 19 different regions by Covered California, and not all plans are offered in all regions. You can go to the Covered California website to find out which plans are covered in your area, and then determine whether or not you want to try and get on the panels for those plans or not. Open enrollment is going to last from October 1st until March 31st of 2014. After that, open enrollment will only be from October to December. So there had been a thought that consumers would be able to just not purchase insurance even with the individual mandate, and then, should something bad happen, buy insurance as they're going into the hospital. But that's not going to be the way it works for individual plans. Employers can purchase plans anytime during the year that they want, but individuals are going to be limited to the open enrollment period. For those individuals who opt not to purchase insurance, there will be a penalty assessed at the end of the first year of $95, or 1% of your taxable income, whichever is greater. That will gradually increase to 2.5% of your taxable income over the next, I believe, 3 years. Right now, while enrollment numbers have been fairly good, I suppose, they're not reaching the targets that both the state and the feds were hoping for so far. A lot of young, healthy individuals are continuing to choose not to purchase insurance. One of the things that has become clear is that, yes, insurance premiums were skyrocketing and were out of reach for a lot of people in California and across the country. But the Affordable Care Act doesn't make it cheap unless you qualify for a subsidy. It just makes it less expensive. So for a lot of individuals who don't qualify for a subsidy on the exchange, they're looking at premiums of anywhere between $350 to $1,000 some odd dollars per month, which is not, cheap. So a lot of these people may continue to choose not to get insurance because it's still less expensive for them to pay the penalty. That's going to be an issue as we move forward, in large part because the insurance companies have, even before the exchange opened, the insurance companies were talking about all these different things, factors that would weigh in and cause them to have to increase premiums over the next, year or 2 or 3. One of the things that is one of the things they yell about most is the fact that they need to have a bunch of people insured in order to cover their costs. They are insistent that they're going to all go broke and lose, tons and tons of money. I don't actually believe that personally, but the Covered California Board seems to listen to them a lot. One of the more difficult parts about the Affordable Care Act is that it puts a lot of control with the insurance industry, and that's asking for an altruistic behavior from a group that's not particularly designed to be altruistic. They really want to collect a lot more premiums. I don't know that they really want to pay a lot more claims. Oops, hold on. Okay, I lost a slide. So, okay, so I didn't have a slide for this one. Just for your information, if you go on to the exchange or even off of the exchange on the individual side, all benefits are now described as metal levels: bronze, silver, gold, and platinum. That determines what percentage is covered by the insurance company and what percentage is covered by the consumer. For a bronze plan, it's a 60-40 split with the consumer paying 40% of the costs. In the silver plan, it's 70-30, gold is 80-20, and platinum is 90-10. Bronze plans will have the lowest premiums, and platinum plans will have the highest premiums. There will be no plans offering catastrophic insurance for people who are not between the ages of 26 and 30. You have to be between 26 and 30 in order to purchase a catastrophic plan at this point. Kids can stay on their parents' plans until they're 26, and for whatever reason, unless you can show evidence of severe financial hardship, and I haven't determined exactly what that means, once you hit that 31-year-old birthday, you can no longer purchase a catastrophic plan. For those who want to purchase a plan on the exchange, there are cost calculators available on Covered California. They will help you to determine, first of all, if you can qualify for a subsidy on the exchange. For people who can qualify for a subsidy, you can get insurance very, very inexpensively. Of course, you have to show that you're not making that much money, but they do offer significant cost savings. I mean, I've seen plans if you put in a $40,000 annual income and a family of 3, you can get plans for $20 a month, which is a lot less expensive than what you have to pay right now. However, you know, you're also dealing with the craziness that is Covered California. And I had a thought that I was going to share with you all, and it just completely went out of my head. Also, you're going to have an expansion in California. Not all states chose to expand the Medi-Cal or Medicaid in other states benefit, but California did. So consumers can have a higher level of income and still qualify for Medi-Cal if they so choose. We'll talk a little bit more about that in a few moments. So provider panels on Covered California, some of them still include or do currently include a doctor of chiropractic, but we don't know for sure how that's going to work as we move forward. I know that I used to be listed as a provider on Blue Shield because I contract with them, and I've spoken with their provider specialists a number of times on the phone, and they've assured me that I am part of their plan panels. But then just recently, I was not again, and so I have been working with our contacts over at Blue Shield to find out exactly what's going on with that. We are being told by Blue Shield that Covered California has issued a directive that does not allow the qualified health plans to put doctors of chiropractic on their panels. I haven't been able to verify that yet, and I was on Covered California just this morning, and I still am listed as a provider for other insurers, just not Blue Shield. So we are in the process of trying to figure that out. If it turns out that Covered California has issued that directive, we do have the opportunity to go back to Covered California and get that addressed fairly quickly. And the plan panels are changing constantly. They're not particularly well maintained. I know that Covered California has said that they are updating them every couple of weeks, but I'm listed as speaking Spanish, and I don't. I'm hearing from our colleagues over at the CMA that there are physicians that are being listed for plans which they aren't part of. So there's a lot of confusion still. One of the other things that we've heard about is that the federal law requires that there be adequate provider coverage, but insurance companies have been talking about using a narrow network. The insurance companies, when I speak to them, don't do this, but they've been in print in a number of different sources saying that they're going to offer maybe 1/3 or 1/2 of their overall provider panels from off of the exchange. That is a concern, and Covered California says that they are going to be monitoring this, but they are not a regulatory body. And because the plan panels are changing so frequently, we don't know exactly, you know, who's on these plans and who's not. We are telling our doctors who have patients who come in who've got new coverage to try and call the insurance company and verify the benefits, but don't necessarily trust what you're hearing. We'll talk more about billing and that sort of thing in a moment. One of the other things that, as much as we have been working hard to make sure that doctors of chiropractic are part of the plan panels, that's because I think it's vital that our doctors have that choice to make that business decision as to whether they want to participate on a panel or not. But we don't know what reimbursement is going to look like on the panel. It's not likely to be particularly robust. Also, and I've got this on the slide, health plans have to notify the providers on the panels 30 days after a consumer has stopped paying their premium. But the federal, excuse me, the federal law requires that those same providers continue to provide care for 90 days. So that's, I don't know what that means. I don't know. I know you can't abandon your patients, but you, I suppose, could require that they pay up front, but it's going to cause some ethical issues for doctors in terms of if they just say, no, I'm not going to treat you because I don't know that you're going to pay me. I know that that would be an appropriate business decision, but we are governed by, all sorts of crazy rules and regulations, and so it's going to be interesting to see how that plays out, not just in doctors of chiropractic offices, but for all the providers who are on these networks. So to find out if you're on the panels, this is a very busy slide, I know. It's a part of information that it's on the California Chiropractic Association website. On the homepage, there's a couple of different links. And so this is just an example of how you can find out if you are part of a panel on the exchange, if they're even answering that question adequately. So you can either just call the health plan, or those are the regional numbers, or you can go online through Covered California, which is how I've been doing it. Well, I've been doing both, but you can find your doctor, and I just put myself in as the doctor I was trying to find, and then I sorted the plans by which ones I was included on. And as I said, it changes on a fairly regular basis, which can be a little bit frustrating, but it's the best I can do with it for right now. So CCA met, as I have said, with representatives of Blue Shield by conference call in December, and talked a lot about how they planned to implement non-discrimination language. At that point, they were still determining how they were going to do that. They hadn't yet put together their finalized panels. They were largely in agreement with our argument that if we were on the panels, we should be reimbursed for all the services that are covered services that are within our scope of practice. But as I've said, they've now turned around and told me that they are not allowed to keep us on their panels anymore, at least for those panels on the exchange. Blue Shield has contracted now with American Specialty Health for their HMO small business plans to provide the provider panels. I am told that if, as a contracted provider with Blue Shield, for their PPO plans, that I will be included on plans off of the exchange and in their PPO small business and large business or large employer plans. But we're still kind of trying to find my name on some of those panel lists. It looks like I'm still listed for all of the employer plans, but not necessarily for the PPO plans off of the exchange. And as I said, they are in the process of researching that for me. And obviously my experience will largely let us know what they're planning to do with other doctors of chiropractic as well. I know that Blue Shield, while we have some issues with them on different business decisions that they have made and policy decisions that they have made with regard to doctors of chiropractic, they have been largely positive about including doctors of chiropractic in their plans in the past. They've done a couple of commercials that encouraged their insured to seek out their doctor of chiropractic. I do know that one of the things that we're also trying to do is to make sure that we are included appropriately with not just Blue Shield, but with Anthem and HealthNet and everybody else. Kaiser does not employ doctors of chiropractic, so we've kept that off of our list of people to talk with for right now. They do have a chiropractic benefit through ASH for their small group plans, and that's going to continue. CCA also met just last week with representatives from Covered California to talk about whether or not they had this directive. The gentleman that we met with said that Covered California issues a ton of directives, and until we could actually provide him with the language of this particular directive, he wasn't going to research that for us. We are, like I said, in the process of trying to find that out and get that acted on as quickly as possible. But also, Covered California will be having meetings relatively soon to start discussing whether they will allow alternative benefit plan designs starting in 2015. That would mean allowing additional services besides just the essential health benefits, and with any luck, would mean allowing a chiropractic benefit to be offered. We don't know how that's going to play out yet. We've got some really good cost effectiveness and patient satisfaction studies that should assist us in making that happen. CCA has met a number of times also with a man named Herb Schultz. He's the Region 9 Director of HHS here in California. He is very pro-alternative types of providers being included. He's a huge fan of chiropractic in particular. And so he has been helping us to connect with the people that we need to talk to and giving us as much assistance in our quest to make sure that we are fully included and our patients have access to us as possible. Interestingly, and this is, I think, going to be something that is going to determine, hopefully, how 2706 is implemented in California. The federal Blue Cross and Blue Shield plans are complying very clearly with the non-discrimination language, and in fact have removed all restrictions to the number of visits that doctors of chiropractic can have with their patients on the federal plans, and so that's very encouraging. Hawaii's Blue Cross Blue Shield has also done the same thing, and as I said, we're still working with Blue Shield, and I've got a contact person now with Anthem Blue Cross to make sure that California also complies with the non-discrimination language and fully utilizes their doctors of chiropractic for their patients. So how do we bill? This is the big question, and I don't have a perfect answer. In meeting with Dr. Brad Sullivan, who is the chair of our insurance committee department, and in talking with the insurers, one of the things that the insurance companies are concerned about is doctors using alternative codes to get reimbursed for CMT, because CMT will not be reimbursed, at least for 2014, by the individual plans in California. Their concern is they're going to see a huge increase in 99213s. So this is what I say about beware of upcoding, because if you can't document a need for a higher level evaluation management code than what's already included in a CMT code, and if you don't document it really, 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 really well, you're going to be accused of insurance fraud. I don't think that they have as much concern about doctors utilizing physiotherapy or rehab codes inappropriately as much as they do with the EM code, and perhaps with the manual therapies code, because we are required to use the most specific code available to us. So what we're suggesting to doctors is that they bill for everything that they do. If they do a level of evaluation management that's beyond what would normally be included in the CMT code, then go ahead and bill it, but make sure that you don't bill it too high, and make sure that you document it. Bill your CMT code, bill any physiotherapies or additional codes that you do for the patient. Make sure you're documenting really well. Bill the patient for the CMT code. And if we run into problems, and then if the insurance companies aren't utilizing us appropriately, and if we run into problems with non-discrimination and find out that we are being discriminated against, then if you get denials that you think are inappropriate, hold on to those, let us know. We'll start compiling them. We will be giving instructions about exactly how to get to the Department of Managed Healthcare and the California Department of Insurance website provider complaint section, because they will respond to those complaints, particularly if we have a lot of them. But you can't complain about not getting paid for the CMT code, because that's not part of essential health benefits. It's not a required benefit. We just want to be included for all those things that are part of the covered services. So please, please, please do your best with that. One of the things that has come up is that particularly, so consumers are going to be out there purchasing insurance plans, a lot of them for the first time. We believe that most people are going to try and get the lowest premium plan that they can possibly afford that makes sense for their particular health issues. That means a lot of people are going to be purchasing bronze plans. The bronze plans patients are going to essentially be cash patients, because their deductibles are between $4,000 and $6,000 per calendar year, and if they happen to meet that, then their copays are between $40 and $60. So it may be that, and I'm not telling people what to charge at all, but it may be that that it ends up being essentially like treating a cash patient. So that is just something to consider. I don't know how they're going to apply bills to deductibles. As we know now, we bill an insurance company and they change our amount that we bill to what they call their usual and customary, and very rarely has anything to do with what the number is we actually billed. So I'm not really encouraged that deductibles for these higher deductible plans are going to get met in any given year unless you've got a family with significant health issues, in which case they're seeing providers a lot. So I mentioned briefly Medi-Cal before, and the fact that it has been expanded now to include a lot more, potentially include a lot more individuals and families who can now apply. It used to be you had to have children to be able to be qualified for Medi-Cal. Now single individuals can qualify. And last summer, a Senate bill addressing Medi-Cal was passed by the legislature and signed by the governor that said that it included outpatient services to include all of these different what are called Medi-Cal optionals. That includes optometry and chiropractic amongst a series of other things. And so in talking with Senator Hernandez, he indicated that he was adding us back in, everything was good. CCA and Dr. Tracy Cole met with the Department of Healthcare Services that manages Medi-Cal in California in the fall, and started the conversation with, hey, so starting in January, when chiropractic is now part of Medi-Cal again, here's what we've got some questions about this. We'd like to see maybe changes to the system that would allow a 24-visit total for each calendar year as opposed to a 2-visit per month sort of arbitrary system. And the fact that the Medi-Cal in California was transitioning into a new HMO instead of fee-for-service system, and how doctors of chiropractic would be included in that, and whether we could be part of the gatekeepers or whether we had to get authorization from a medical doctor for treatment. And it was a good conversation, but we didn't have all of our questions answered, which we didn't expect to. So we met with them again on January 14th, and this time we were told that no, we were not added back in. No optionals were added back into Medi-Cal. That when the bill talked about outpatient services, they were defining that as not being inpatient services, but only meant outpatient hospital or outpatient hospital clinic services, which doesn't even make sense. We are in the process of trying to figure out what's going on with that. But for right now, it appears, at least as far as the regulatory body who oversees Medi-Cal, they aren't going to be including doctors of chiropractic as providers, or at least I shouldn't say it. They are not going to be including a chiropractic benefit. Now, having said that, this new HMO system does allow each of the, I believe, 58 counties now that that are part of this, which I believe is the entire state of California. It's now an HMO system. It's a gatekeeper system, and under this system, plans are allowed to offer benefits beyond what are included in Medi-Cal. So we are now looking at how to reach out most effectively to the different plans to show our cost effectiveness, because that's really going to be the key to to encouraging them to include additional benefits. But at least in theory, and this is still working its way out, but at least in theory, a gatekeeper medical doctor could authorize chiropractic treatment, which would then be reimbursed in the system. And Medi-Cal still reimburses for everybody who qualifies under the rural health clinics, and also for a certain subset of patients like pregnant women. And there was one other thing that I forget what it is. But anyhow, so I know that for anybody who was listening to my previous discussions and who saw stuff I had put out in writing that said that we are now included in Medi-Cal, apparently, at least for the time being, that does not appear to be the way the system is working. So I wish I had a better answer on that one. But we are, as I said, this information just keeps changing on us. And we were a little perplexed by the fact that we had had a half an hour, 45-minute long meeting with the Department of Healthcare Services in the fall, and they were all, yeah, you guys are in, and then all of a sudden, no. So I'm working to get to the bottom of that as well. So as I keep repeating, all of this information is very, 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 very fluid. I am updating these 2 different tabs on the homepage for CCA on a pretty regular basis. The chiropractic / covered CA is the one that gets updated the most frequently. The other one is just FAQs, but it also gives you the link to finding out if you're a provider or not. And so as I get more information, I'm putting it on there. I'm taking off the information that has changed or has become incorrect. And I apologize for the fact that it sometimes seems like nobody knows what's going on, but we are not the only, I mean, everybody's still trying to figure this out. I believe that this whole system is going to morph a lot for the foreseeable future. And we're hearing more and more that what a lot of people seem to think is going to be the long-term outcome of this is a single-payer system, which nobody wanted when Congress was passing this bill, but it may be that by the time this kind of a nightmare slow-motion train wreck finishes doing what it's doing, it may seem that a single-payer system is all of a sudden a lot more popular. So we will see how that works. That is actually the end of my slides. What I'm going to do is let's just see if I'm going to unmute people. And if you don't have a question, if you could take yourself or put yourself on mute on your own phone, that would be helpful, because otherwise we're going to get a lot of background noise. But just a second, let me see if I can get these all undone. Almost. Sorry. There's probably a faster way to do this, but I'm not figuring it out. So I'm getting a bunch of background noise. If you're not going to ask a question, can you put yourself on mute, please? And okay, I think I've got everybody off. Does anybody have any questions? I'm sorry, was that a question? I can't believe I answered everybody's question in the course of this whole thing.
I want to speak to you.
Karen Borges, are you raising your hand? Oh, I couldn't see. Sorry.
Not on purpose.
Okay.
Is my hand down now, or is it up?
Pardon me?
Is my hand down now, or
No, it's
is it
still up, but that's okay.
So now it's down?
Now it's down.
Oh. No, I don't have any questions. It's just so confusing. I still don't know what's going on.
I totally understand that, and just I was just told that I said things can't be changed until 2012. What I meant to say was 2016. I apologize. And I know that it's confusing. Trust me. I feel like I've got a pretty good handle on this, and it's still confusing to me. So Dave Cox asks, where are Uncovered California? Can you find out if you're on the plan? Go to the CCA website, and on the home page, click on the Covered CA FAQs, and you'll find a link that gives you the instructions that I had. It's hold on, let's see if I can go back. Oops. So you can either call the plans, and this is all on that FAQ. There's a link on the FAQ that shows all the different phone numbers for the regional and the statewide plans, or you can go through Covered California in this little step-by-step instruction on how to pull yourself up on that. And Richard Latimer, did you have a question? No, your hand's up, but no question.
No question.
Okay. And I just lost my tab that lets you write in questions. I don't know where that went. So if you have a question, you're just going to have to ask it out loud. I'm sorry. All right. Well, I will obviously be continuing to put out updates on this at least every month, as well as trying to make sure that I update the Chiropractic and Covered California part of the CCA homepage pretty much every week, if not more often than that. I'm trying not to put up information that I haven't verified unless I think I can make it obvious that I haven't verified it yet, because I'm trying to be as accurate a source as possible for everybody. But there are times where we have what appears to be hard and fast information, and then all of a sudden it changes out of the blue. And so I totally understand the frustration with this. My goal right now is to make sure that you're verifying insurance with your patients a lot for the start of the year, unless they've kept the exact same employer plans. Individual plans have changed dramatically, and you've got to try and verify what's going on with that. HealthNet, I know, put out a thing to their providers that said if you can't verify that a patient has coverage, to treat them as though they are uninsured, and then just go back and reimburse them if it turns out that you're going to get paid by the insurance company. It's really going to be important because patients are going to be frustrated. I know I've got patients right now that have signed up with the Covered California Exchange, but have submitted payment, but they have no proof of insurance right now, and so we're just waiting until we get that and going back and billing and seeing what happens. But in the interim, I'm treating them as a cash patient. Somebody's either eating chips or something. If you could put yourself on mute, that would be helpful. So, again, I know I keep repeating that. I know it's confusing, and I'm sorry that it is. Dave Cox, is that hand up on purpose again, or is that just something that didn't go away?
Yeah. Is Medicare affected?
Medicare is not affected. Medicare, Medi-Cal, those benefits are not specifically affected by the Affordable Care Act. Large employer groups have not been affected. Small employer groups have got a reprieve to doing anything mandatory until 2015. It's the individuals and the small employer groups who choose to make changes right now that we're looking at, and also grandfathered individual plans. Those plans, like I said, that have been in effect since March of 2010, when the Affordable Care Act was signed. Those plans, unless they change their benefits substantially, I don't know what exactly substantially means, but as long as they stay substantially the same, those plans are not affected. Does that answer your question?
Yes.
Okay, thank you. Okay, well, we're within 5 minutes of the time being up, so unless anybody else has got any other questions, anytime as we move through this, if you have any questions and you're not being able to find it on the website, please feel free to call me. I'm at 916-648-2727, extension 130, or you can always email me at kdonoghure@calchiro.org. And I will be happy to answer any individual questions as I'm able to. Okay, well, I thank you all for participating. I'm going to try and keep this going as much as I can. I will, again, continue to update you as I find out what's going on, and it's just going to be a very interesting ride for a little while, and that's not just for us. It's for everybody in the system. It's for all the different providers. It's for the consumers. And, to some degree, the insurance companies, I think they're still putting a lot of their policies and procedures into place even now, which I think is partly where some of the confusion's coming in. Okay, well, thank you all very much. Have a good day.